Hey everyone, welcome to Mohican Trails site. So you have probably been redirected from the Survival Crafts site over to this one. And in this channel, we're going to be talking everything about plants. Now, I've done one already on this channel about yarrow. I'm probably going to end up redoing that one a little bit. That's a few years old, and it was more to talk about stuff that I was going to be doing with Parks Canada. On the video from Survival Crafts that you may have been redirected from, I mentioned I was going to talk a little bit about my background and my understanding of medicine. I am a Cree Iroquois Métis, and I had a grandmother, a Cree Iroquois grandmother, who was very well versed in our traditional medicines. And my grandmother, Mary Belcourt, taught me from the time I was very, very small a lot about our plant medicine, about our traditional medicines, and my mother did as well. I've also learned from many different elders, not just Cree elders. I've learned from Blackfoot elders and Ojibwe elders, and I've spent a lot of time trying to learn and understand our medicines as much as possible. So on the traditional side of things, I have a very long background of traditional medicine. I also did 2 years of herbology at a local college just north of me, 4 hours north of me up in Edmonton, from a very amazing man by the name of Robert Dale Rogers, who is extremely knowledgeable. And he also learned quite a bit of traditional medicine from my people as well. So I'm very proud to have been one of his students. He's a great mentor. I also completed a course, an online course with another person who is a military medic, and he was also involved in herbalism for many years, and I really felt that he was very beneficial to my learnings. He's a very good teacher. And at some point in time, I'm going to be talking a little bit more about him and his teachings. I think he's pretty phenomenal. And I'm currently enrolled in a course through learningherbs.com with Seven Song, who I have a great deal of respect for. I go back to basics an awful lot. I do it as regularly as I possibly can. You can't possibly learn everything that there is to know about herbal medicine. And so I find myself going back to basics a lot. And in fact, I'm doing Seven Song's herbal first aid course, which is it's a lot of fun, and I'm learning quite a bit, not just from Seven Song, but also the other students. They're a great source of information, so I'm really enjoying them a lot. I'm an advanced wilderness first aid instructor, and I also teach a lot of outdoor programs, everything outdoor. My husband and I have a guiding company, and we are also involved in teaching for the Interpretive Guides Association. We have conducted many programs for Treaty 7 and Métis Nation, etc. And we've done stuff worldwide. We've been involved in projects in Barbados to do with cave rescue and disaster management, all sorts of things like that. In addition to that, I actively teach my own plant medicine courses and my own plant first aid courses. So I feel pretty confident that I am going to be able to talk a fair amount about plant medicine. On this week's video, I want to talk mostly about really how plant medicine actually works. I want to be very clear though. My only intent is to assist people in making informed decisions, especially when it comes to herbal medicine. I also want to make it very clear that I'm not doing these videos so I can answer people's questions on their particular illnesses. That's something that needs a clinical intake form, and it needs a whole lot more than just a quick little bit of information thrown across the internet and then expecting me to answer questions like that. Often these issues are far more complicated than people might realize, and so it's not something that I can easily just whip out an answer for you and give you information. What I can do at times, and I'm not going to spend a lot of time on this, so please don't fire too many questions at me, But in some situations, I can certainly talk about more acute things such as wound care and minor burn care and other minor first aid situations. I don't want to answer a lot of them. I don't want to spend a lot of time doing that, but I will certainly answer the odd question that comes across my email or my inbox. Okay, so let's begin. I want to start by talking about some fundamentals in plant medicine. And in order to do that, we need to understand a little bit about how plants actually work as medicine. So a little bit of background. A lot of our current medicine, our pharmaceuticals, still come from plant medicine. And it's estimated anywhere from 40 to 60% of pharmaceuticals are still coming from plant-based medicine. And in fact, I don't know the exact percentage, but there's a large number of people in the world, primarily in third world countries, I would imagine, that are still relying on plant medicine as their basic health care. Now, the cool thing about pharmaceuticals is their very rapid response within the human body. Now, this is mostly because of the chemical isolates that are found in a plant. When a plant is discovered to have a particular action on the human body, there's a great deal of interest in finding out what chemical is responsible for that particular action within the body. So this chemical is extracted from the plant so it can be replicated and utilized in a specific manner. For instance, pain, or perhaps stopping a heart attack, or perhaps dealing with stroke, or any other number of medical issues. Now, this single chemical constituent, without the dilution of the other chemicals found in the plant, can be highly concentrated, and so it will very quickly react within the human body in the specific manner that it was chosen for. However, with this model, there are often unpredictable results that eventually become predictable because they happen so often. These are known as side effects. Now, the interesting thing about the pharmaceuticals is that they will actually command and direct the body how to respond to a certain illness. Plants, on the other hand, have a much more gentle approach. Not only do they contain the specific chemical that is of interest in terms of an action required to be done on the body, in addition to that chemical, there are a whole host of other chemical constituents, and all of these chemical constituents work together very synergistically to create wellness within the body. They have a much more gentle approach than pharmaceuticals. And herbal medication supports the body. At the end of the day, the body always fixes itself. That's what we're designed to do. And although pharmaceuticals can be very directive and change the body's reaction to illnesses, it's not always going to be the best outcome. Sometimes it certainly is, but not always. Whereas with herbal medication, it works with the body and either nourishes, stimulates, balances, calms, whatever action it is to allow the body to do the work that it was meant to do, and that is in healing itself. Now, effectively, herbal medications, for the most part, really don't have an awful lot of side effects. And in fact, most herbs that I work with, and most herbs in general, don't have side effects. Now, they will interact with medicine. However, for the most part, they increase the efficacy of the medicine that you're taking. What that would mean, for example, if you were talking about, say, tuberculosis and you're taking drugs for that, things like dandelion would enhance the efficacy of that drug. Now, if it enhances the efficacy of that drug, it will also enhance the side effects of that drug. So usually it's a good idea to really do your research and determine what herbs will interact with what drugs and how they interact. The other thing that we should talk about with plants is how they actually work and interact within the body. When somebody has an infection, for example, and it could be anywhere in the body. It might be in the brain. It might be a throat infection, lung infection, something to do with the bowels, or perhaps even externally. But for our intents and purposes, let's discuss what happens inside the body when we have an infection. With pharmaceutical drugs, they're quite miraculous in terms of how they will deal with and treat infections. With the drugs that we introduce into the body, it's not just one single chemical constituent in most drugs. There are sometimes many different compounds that work together. And what they are designed to do is to go to the site specific to the infection. And so it's this chemical cocktail that cascades through the body and goes to the particular site of infection. And that's the miracle of current drugs, is that we have the ability to do that. Now with plants, it's a little bit different. Some plants can be systemic, and that is they'll go throughout the entire body and reach the infected site or the site of infection. With many herbs, though, they are more localized. So what does that mean? A localized herb means that it might be very specific to the lungs, or it might be specific to the kidneys or to the digestive tract. Now, they may be very powerful antibiotics, but if they are specific to the digestive tract and your infection is in the lungs, they're not going to help you. They're not going to do much for you at all. And in fact, a very small percentage of the chemical constituent responsible for dealing with that particular infection, only a very small amount may actually cross that barrier to get into the bloodstream and to be taken where it needs to go. And that's not terribly effective. If there's not enough of it to do the work that it's supposed to do, it's not going to have real efficacy. However, if you have something like Giardia or some other intestinal-borne illness, then the plants or the herbs that work on that particular bacteria or virus or whatever enteric illness that you have that stays within the digestive system, well, then the herb has the ability to work with that. And then, of course, the lung infection, there are different herbs that are much more specific to the respiratory system. And that's where they are favored. So they're usually very localized and specific to one organ or another, or perhaps several organs. So these are localized herbs. Systemic herbs, of course, work through the entire system. And then, of course, there are the helper herbs. So these are herbs that will help to boost the ability of the other herbs that you take in terms of their efficacy for healing or for dealing with viruses, bacteria, or whatever else the situation is that is going on. Now, some herbs are very nutritive to the body and the organs in question. Other herbs will help to stimulate where it's required to stimulate. Other herbs will help to calm where it is required for them to calm. And they may do a whole host of other things on top of their specific functions that you're asking them to do. So other things that we can also consider is, how does the body get rid of the herb? So does the herb exit through the bladder? If it does exit through the bladder, then there is the potential there for it to be a good herb to deal with bladder situations. Or perhaps it exits from the lungs, maybe the skin. So wherever the herb actually exits from the body, it also has the potential to heal that part of the body too. And that's all good news. Now, I think the other thing that we need to consider too is, what actions do the plants have on the body? So some herbs can heat the body up and dry it out. And maybe that might be specific to the lungs. So you may have, if you have somebody with lungs that they're cold and they're wet, so they're very, very phlegmy. Somebody that's constantly got that runny nose and their eyes are watery and they just have a cold constitution all of the time and they're miserable. Well, then a warming and drying herb is a good idea. One that is specific to that particular tissue state and that area of the body, such as the lungs, the sinuses, the eyes. You can also get people with very hot, dry, unproductive coughs, for example. Maybe marshmallow root, for example, would be very good for helping to cool that and to support the mucosa within the lungs, to heal that, to help moisten it, to help cool it, and perhaps to help even not just soothe the tissues, but to move anything that is in that tissue out of the body. Same as any other part of the body. So inflammation responses in the brain due to, who knows, tick bites or mosquito bites or whatever. So inflammation anywhere in the body that requires to be cooled down and the inflammation response calmed down, there are herbs that can deal with that as long as they are specific to that part of the body. So it's not just the specific area of the body, it's also the specific action of the plant on the body too. So it might cool things off, it might warm things up, it might dry things, moisten things, it might reduce cramping, it might stimulate cramping if it's required to do so, such as uterine contractions, for example. So there are all kinds of different actions that the herb can have on the body that are not necessarily just specific to location too. So all of these things in combination have to be considered and thought about when we are dealing with herbal medication. It's not just a matter of taking 2 tinctures and calling me in the morning. That is very much a Western approach. And there's nothing wrong with that Western approach. With herbal medicine, it doesn't quite work that way. We're all snowflakes. All human beings react to different things in different ways. And with some people, you're going to have to determine how effective a herb may be on them. With some people, certain herbs may not have an awful lot of effect on them, depending on their constitution, whereas other herbs may affect them very, very well. It's no different than pharmaceuticals. They're the same way. Some pharmaceuticals will work really well on a certain person with a typical constitution, and they may not work on somebody else at all. I know from my own experience that has definitely been the case, where certain pharmaceutical drugs that I have had to take have really not done anything for me, and in fact they've actually worsened me quite a bit. Whereas going back to the doctor and letting them know that, then they changed the medication and things worked out a whole lot better. So herbal medication is really not a lot different that way from Western medicine. However, one of the biggest differences is in how they react and respond to the body. They're very synergistic with the human body, and they work with us very, very well. Basically, herbs are just plants. They're food. They offer nutrition. They can offer healing, all sorts of different reactions within the human body. Don't ever take anybody's word for it when it comes to herbal medicine, not even mine. I'm just saying that you need to have a very informed perspective before you make decisions on whether you want to go down a conventional road, whether you want to go down a herbal road, or whether you want to integrate the both of them. Make sure that you do your homework, that you do your research, and you don't just blindly follow something that you saw on Facebook. So, rant over. I really hope that people will take a step in that direction. Seek out that plant medicine if it interests you. If it's something that doesn't interest you, turn off the video. This probably isn't for you to watch. But if it's something that you are interested in, if it's something that you do have a passion for, then I highly recommend you get the training and you start talking to as many experts as you know. And please go to a reputable expert. Go to a reputable school. Don't just talk to Joe Blow off the street who, dealt with his bunions. Although that's wonderful stuff, there's more to it than that. That's all I'm saying. So, have a great day, and we'll see you on the next video. Oh, by the way, if you do have an interest in herbal medicine, and there are questions that you would like to have answered, or particular plants that you might have some curiosities on, why don't you send me a line and I'll see if I can answer those for you. Have a great week.